Dr. LaRoche, first of all, welcome to Voice News Network.
Thank you for having me.
As you know that January is Glaucoma Awareness Month, and being a specialist, you work with people of color and you educate them about the dangers of glaucoma. And while this disease is common in many races, not many people are aware about it. So what is glaucoma?
Yes, thank you. Glaucoma is a disease of the eyes, okay, usually associated with elevated eye pressure, okay? When you touch your eye, there's a pressure to that eye. That normal eye pressure is about 15. When the pressure goes up higher, around 18 and higher, that can start to lead to glaucoma. That can lead to damage to the nerve that connects the eye to the brain. And that can lead to slow peripheral vision loss that you don't really see until it's very, very late. And by the time you notice it, you may have lost 90% of your vision. So that's what glaucoma is the majority of the time. There are some less common cases that occur, secondary cases that can occur in infants and kids and children. But usually this is an adult disease that starts around age 40 or 50 years of age.
Okay, so, who are at high risk of glaucoma?
People with a family history of glaucoma, the elderly, people who've had trauma to the eye, those are the main conditions. People also have large lenses in the eye. In my practice, the most common cause of glaucoma is the enlargement of the lens inside the eye. And this is called, usually when it becomes large and opacified, it's called a cataract. But with aging, it gets larger in size. And when it gets larger in size, it blocks the drain inside the eye and also rubs up against the iris, the part of the eye that gives you the brown color of the eye. It rubs up and releases pigment that blocks the drain as well. So we have better techniques now with earlier surgery to take this cataract out and open up the drain with small devices, micro-invasive devices, like a thin needle, to open up the drain to help lower the pressure. These procedures take about 15 minutes. We do it at the hospital in the operating room, and you go home the same day. 80% of the time, you can get people off of eye drops. The standard of care is to use eye drops to help lower the eye pressure. 80% of the time, we can get people off of eye drops with this earlier surgery.
Mm-hmm. So, in most cases of glaucoma, I was reading about it, there is no pain and the loss of vision occurs slowly. So what are the early signs to diagnose glaucoma?
Glaucoma is called a silent thief of sight because that pressure elevation from 15 to 18 or higher, you don't feel it. You don't feel it. And like I said, it slowly takes away your vision. Unless you have an acute attack of glaucoma, that's called angle closure, where the pressure shoots up to like 50, then you would feel some pain, but that's rare. So that's why it's very important that everyone gets a complete eye examination. You go see your specialist, your ophthalmologist, your optometrist. They'll check your vision. They'll take your history. They'll check your cornea, check for your lens, check for cataracts, check the eye pressure. Like I said, the mean normal is around 15. They'll dilate the eyes, take a look at the retina, take a look at the optic nerve to look for optic nerve excavation. Inside the eye, the optic nerve, normally you have a small cup, a cup disc ratio that's small, but with glaucoma, it gets larger and larger and larger. And we can look inside and see that as well. So those are the things. That's why it's important. If everything's okay, you get your eyes checked once a year. And if you do have glaucoma, make sure all your family members get checked because it can run your family.
Yeah. So what are the best options according to you, through which we can prevent complete loss of vision in patients suffering from glaucoma? Like what kind of surgeries are involved?
Well, like I said, the early cataract surgery and micro-invasive glaucoma surgery, cataract surgery is so much more safer now than it was 25 years ago. It's the most common procedure done in the Americas. Millions of people have it every year. They have improved vision with multifocal lenses, and it helps to lower the pressure by about 5 points to help prevent glaucoma. Okay, and then also we have these new techniques with new devices to open up the drain as well. These micro-invasive devices we didn't have, 10 years ago. So these techniques work very well to help lower the pressure. So in my practice, we have like a early surgical approach with earlier cataract surgery and micro-invasive glaucoma surgery, and then we'll offer medications thereafter. And most patients choose to have that technique. We have some patient testimony videos as well on my website where you can see what the patient has gone through and how their vision has improved as well. So that's great news that we have new techniques to really help prevent blindness from glaucoma, reduce medication burden, many times get people off of eye drops so they can go back and live a normal life without being burdened with the thought of losing vision.
Mhm. And in the end, what measures you would recommend to our viewers so that they can prevent themselves from glaucoma?
Well, some things that you want to do is make sure you get your eyes examined, get your eyes checked, because the doctor will be able to pick that up. There's no symptoms for you to pick up per se. So you want to get your eyes examined. That's the most important thing you can do. And the other thing is the things that you can do personally: eat healthy, lots of salads, lots of vegetables, baked chicken, baked fish, a healthy diet, exercise. Exercise improves the blood flow to the eye in your body. Walking 30 to 60 minutes a day is very important. Meditation, relaxation. By meditating and relaxing, breathing through your nose, deep breaths in and out in a dark room, in a quiet area for 20 minutes a day is a simple form of meditation that could lower your blood pressure by 20 points. It could lower your eye pressure by 20%. And that helps to prevent glaucoma and as well.
And Dr. LaRoche, you talk so much about how important it is to get vaccinated, and COVID-19 cases are rising here in Canada and in US as well. But still there is a lot of hesitation amongst people in getting vaccinated. Why do you think it is like this?
I'm in New York City. In New York City, the Asian population is actually 99% vaccinated. It's a highly educated community. There are a lot of Asian physicians in the community. They're getting the message out, and people are highly vaccinated. In the Caucasian community, it's about 64%, and the African-American community, about 59%. In the African-American community, there's a shortage of physicians. From the history of discrimination in America, there's a shortage of physicians and a shortage of healthcare facilities. So we still have to work to get that information out. But there's also bad information on media. In America, in the right-wing media, there's a lot of bad information because they don't like mandates, okay? The vaccine has been scientifically shown to be safe and efficacious to reducing death and mortality, okay? But the right-wing media doesn't want to acknowledge that. And unfortunately, when I analyze this, I found that the foundation of this really goes back to the civil rights movement. When African Americans were fighting for freedom and they wanted freedom and laws to be passed, there were mandates to saying you cannot discriminate. Okay, those were legal mandates that you cannot discriminate. But unfortunately, there's people on the other side that still want the freedom to discriminate. They don't want mandates. So any mandate you put out there, a mandate of putting a mask, they don't want that because it's a mandate, because they want to just have the freedom to do what they want to do, including discriminate. That's the foundation of that. So this bad information is getting out there, and it's confusing people. It's confusing Americans. And so that's a big thing that I'm running into, some patients that are resistant to getting the vaccine. The other thing is some religious hesitancy. Some people say, oh, it's against my religion, or it's against my beliefs, or I want to do more research. And I don't understand that because, to do research, we have scientists that are experts that have done the research already. And if you're a layperson, how are you going to do research? How are you going to research this information on your own? And so there are some people that, are still on the fence. And I think I'm realizing that we're not going to be able to vaccinate everybody because of that. And so the thing is, there's a certain hypocrisy that takes place, because if they get sick, they're unvaccinated, get sick, all of a sudden they're going to want to run to the hospital. And so if you don't trust the vaccine, why do you trust the treatment that we're going to give you for the vaccine? Why do you trust the antibody, the newer medications like remdesivir, the new pills that are coming out that are even less tested than a vaccine? Mm-hmm. So there's a hypocrisy that's there. And the thing that people don't realize is that if you get this virus, and your chances of getting hospitalized are much higher, okay? And if you get this virus and you're in a hospital, you cannot have visitors, okay? You're gonna be in a COVID ward with no visitors.
Yeah.
And if you get intubated, you have a breathing tube down your throat, you have no visitors. Your family's not gonna be around you. That is not a nice place to be, and people don't see that, okay? You really wanna try to avoid that. Mm-hmm. Now, the other thing that people can do also to reduce their risk is reduce obesity. In America, we have about a 40 or 50% of the people are obese. And when you're obese, your chances of getting COVID goes up by 50%. Your chances of being hospitalized goes up to 100%. your chance of being in an intensive care unit is 75%. And your chance of dying, it goes up 50%. So you want to try to reduce your obesity. Take this time to like really eat healthy, salads, vegetables, baked chicken, baked fish. Exercise, walk 30, 60 minutes a day. But try to lose that excess weight. By doing that, you will improve your immune system, reduce inflammation in your body, and really better protect yourself against COVID.
Mhm. And doctor, you as you've mentioned about the misinformation which is there, very much there in the communities. A lot of people say that once you get vaccinated, certain things happen to your body, and some weird kind of nonsense. So why do you think such misinformation is spreading out in communities?
Well, there are online websites, Facebook pages saying that the vaccine will make you infertile, saying that the vaccine is being used for depopulation, saying things of that nature. It will make you sterile. I mean, there are actually websites that say these types of things. So when people are doing their own research, they're landing on these disinformation website, anti-vaccine websites, and they're incorporating that as the gospel. And that's not science, that's propaganda. And so that's part of the problem. And so we have to do a better job of getting the information out, reaching those underserved communities, getting misinformation out. I think social media now, for example, with Facebook, if anybody puts anything about a vaccine, they have to put the appropriate information to get the vaccine information. And they're starting to shut down sites that are putting bad information out. But that has really hurt the country. That's hurt the country a lot. And a lot of people who were saying they weren't going to get vaccinated have passed away. And we have plenty of examples of that. And so, we just have to work to continue to get the information out there and spread the science that the vaccines help to save lives.
Mhm. Well, thank you, Dr. LaRoche, for sharing your valuable feedback and your information about glaucoma. Thank you very much.
Thank you for having me.